Hello everyone, in this video we are going to discuss about lung pressures during breathing. So the lung pressures are the alveolar pressure or intrapulmonary pressure. So it is a pressure inside the alveoli of the lungs and it determines the flow of air inside or outside of the lungs. So the pressures differ at rest, at inspiration and expiration. So at rest, that is between the breaths, the alveolar pressure is equal to 0. That is 0 centimeters of water, that is equal to the atmospheric pressure. But during inspiration, the alveolar pressure slightly becomes negative, that is minus 1 centimeters of water. So it is less than the atmospheric pressure. That's why the air moves from high pressure to low pressure. It is high in the atmosphere and low in the intra-alveoli. So it moves from the atmosphere into the lungs. That's why. So during expiration, the alveolar pressure increases to positive pressure, that is plus 1 centimeters of water. So it is more than the atmospheric pressure. So the air moves from the lungs to the atmosphere, high pressure to the low pressure. So air always flows from high pressure to low pressure. So the alveolar pressure must be less than atmospheric pressure in order to inhale and should be greater than the atmospheric pressure to exhale. Next pressure is the pleural pressure. So the pressure within the pleural cavity, that is between the visceral pleura and the parietal pleura, is called as a pleural pressure. It is always negative in normal conditions. So at rest it is minus 5 centimeters of water, and during inspiration it will become more negative, that is minus 7 to minus 8 centimeters of water. During forced expiration it becomes less negative or even positive temporarily. The point we have to remember is that the key point is negative pleural pressure pulls the lungs outward and helps in alveoli getting expanded. If the pleural pressure becomes 0, as in pneumothorax, where there is air present in the pleural within the between visceral and the parietal pleura, this pleural pressure becomes 0. So whenever pressure becomes 0, the alveolar expansion will be hampered, so the lung collapses. So another pressure is the transpulmonary pressure. So as the name suggests, it is a difference between the alveolar pressure and the pleural pressure. It determines the lung expansion and it is always positive in normal lungs. So here this graph is depicting all these pressures: intrapulmonary or intraalveolar pressure, intrapulmonary or alveolar pressure, transpulmonary pressure, intrapleural pressure. So here we can see in this graph the intrapulmonary or alveolar pressure, it is 0 at rest and it becomes negative during inspiration and becomes positive, that is upward peak in expiration. Next, the intrapleural pressure, it is always negative. It is negative and it during rest and in inspiration it becomes more negative and it becomes less negative during expiration. And the transpleural pressure, which is the difference between the pleural pressure and which is the difference between the alveolar pressure and the pleural pressure, here it is always positive. So here we will see in millimeters of mercury, intrapleural pressure, that is between the visceral and the parietal pleura, at rest it is negative, that is minus 3.7 millimeters of mercury. It becomes more negative during inspiration. At the end of inspiration it is almost equal, that is 5.9 millimeters of mercury. During expiration it increases and it reaches the baseline, that is minus 3.7 millimeters of mercury. So one thing we have to remember is intrapleural pressure is always negative. Next, alveolar pressure or intrapulmonary pressure, at rest it is 0. During inspiration it becomes it becomes slightly negative, that is minus 0.74 millimeters of mercury. During the end of inspiration it again reaches 0. During expiration it increases and becomes plus 0.74 millimeters of mercury. Next is transpulmonary pressure, which is the difference between the alveolar and the intrapleural pressure. It is always positive, we can see. At rest it's plus 3.7. At inspiration there is a difference, 5.9 minus 0.74, that is nearly equal to plus 5.1 millimeters of mercury. At the end of inspiration plus 5.9 millimeters of mercury, and end of expiration it is plus 2.9 millimeters of mercury. So at rest and at the end of inspiration there is no flow of air. During inspiration there is flow of air into the lungs. During expiration the flow of air is out of the lungs. So why these pressures are different? The thing we have to remember is pleural pressure is always negative. Why? Because the lungs always wants to collapse due to elastic recoil of the lung. tissue, and chest wall always wants to expand outward because of this normal contour of the rib cage. So this tug of war, that lung want to collapse inside and the chest wall wants to expand outward. So this tug of war creates a suction force, making the intrapleural pressure negative. That's why it is minus 5 centimeters of water at rest. Next is during inspiration, what happens is diaphragm is contracted. It moves downward. There is a piston movement, as we know. So this movement causes chest wall to expand. There is an increase in the thoracic volume. We know as the volume increases, pressure will become less. So the pleural pressure becomes more negative. It is minus 7 to minus 8 centimeters of water. So the lungs expand. So alveolar pressure drops to minus 1 centimeters of water. So air flows from higher atmospheric pressure to the less pressure in the lungs. So there is, during inspiration, there is movement of air from the atmosphere into the lungs. So at the end of inspiration, air has entered and alveoli now match the atmospheric pressure again, that is equal to 0. So the pleural pressure remains slightly negative, that's it. During expiration, the diaphragm relaxes and the chest wall recoils inward. So the thoracic volume decreases and the pleural pressure will become less negative because it will increase, but still it is negative. The alveolar pressure rises to plus 1 centimeters of water and the air flows out because the pressure inside the alveoli is positive. The pressure out in the atmosphere is 0. So it moves from high pressure to low pressure. So air moves outward. So this table is showing during inspiration phase there is diaphragmatic contraction, pleural pressure becomes more negative, alveolar pressure is negative, so the flow of air is inward. During expiration, the diaphragm relaxes, the pleural pressure is less negative, alveolar pressure is positive, so the air flows outward. So intrapleural pressure, it is a pressure between the visceral and the parietal pleura. That is visceral pleura on the lung, the parietal pleura on the chest wall. So there is a constant tug of war between these. The lungs try to collapse because of the elastic recoil, and also surface tension inside the alveoli tends to collapse them. And the chest wall tries to expand outward because there is a natural shape and spring-like recoil of the ribs, and the muscles wants to push outward. So this constant tug of war creates a suction effect in the pleural space. So this is that's why there is a negative pressure. These opposing forces pull the two pleura away from each other, but they stay together because of the pleural fluid which acts like a suction, and this creates a negative pressure, normally minus 5 centimeters of water. What happens if the pressure, intrapleural pressure, is not negative? So because if the pressure is not negative, the lungs will collapse, as there is no negative pressure which is keeping it expanded, because lungs always tends to collapse. The pressure which is keeping it expanded is the intrapleural pressure, that is a negative pressure. So if we can take an example like pneumothorax, where there is air entering the pleural cavity. As soon as the air enters the pleural cavity, the intrapleural pressure becomes 0 or positive. That's why it is not negative anymore. So the lungs will collapse during this condition. So these are the important things we have to remember. These are the important lung pressures. One thing we have to remember is the intrapleural pressure is always negative, transpulmonary pressure is always positive, the alveolar pressure at rest is 0 and it becomes negative during inspiration. At the end of inspiration it becomes 0, and during expiration it will become positive. So these are the important points in lung pressure.